If you're a runner that is having foot, ankle pain, you're not the only one struggling from it as a runner. I see it all the time. Runners who are dealing with nagging pain in their feet, Achilles, or ankles, trying to push through this pain only to end up sidelined for weeks. Maybe it starts as a little soreness, then suddenly it turns into something that completely stops you from running. But here's the truth. Most running injuries don't just happen. They build up over time because it is an underlying weakness, mobility issues, and training mistakes. In this video, though, I'm going to break down why these injuries happen and give you simple steps to prevent them so you can keep running strong and pain-free. Hey there, I'm Dr. Siler, a doctor of physical therapy and running coach, and I help runners stay injury-free, recover smarter, and run stronger. On this channel, you'll find expert tips on injury prevention, strength training, and recovery, so you can keep running pain-free. So hit that subscribe button, and let's get started.
All right, so what we're all here for, the problem. Why you as a runner keeps getting injured in your foot and ankle. The reality is, though, that foot and ankle injuries are some of the most common running injuries out there. They are even more prevalent as we get older. The older we get, the more prevalent those foot and ankle injuries become, and the less prevalent the knee and the hip injuries come, which sounds crazy, but that's specifically for runners. Now, the biggest running injuries that I see over and over again are plantar fasciopathy, that stabbing pain in the heel of your foot, in your heel first thing in the morning, or when you first get up, or when you first start running, and it kind of dissipates as you warm up. Achilles tendinopathy, that stiffness and pain in the back of your ankle. Shin splints, which is pain along the shin bone from the stress of running. These three of the foot and ankle injuries are overuse injuries. They are caused by too much stress, too soon, too much of something, overuse. The final most common ankle and foot injury that I see, though, are ankle sprains. These are classified as a traumatic injury. So they, when you roll your ankle and things like that, and it just takes forever to heal. Ankle sprains just take forever to heal, but that is one of the most common running injuries I see. Like I said, it's a little bit different, though, because it's a traumatic injury. It doesn't happen over time. It's a single point where you roll your ankle, and that's where you get that ankle sprain. And if you're dealing with any one of these, I totally get how frustrating it is. But what if I told you that the three overuse injuries, and even ankle sprains to a small extent, are preventable? Overuse injuries are preventable. Most runners don't realize it, but foot and ankle pain usually comes from three main problems. Weak foot and ankle muscles, meaning your stabilizing muscles aren't strong enough, and then your body can't absorb and take the stress of running in that particular area, resulting in an injury. You have limited mobility. If your ankle doesn't move well enough through the range that running requires, then it forces your foot to compensate, leading to injury and pain, that overuse injury again. And then also, finally, training mistakes. Doing too much, too soon, overloading your body without giving it the support and recovery that it needs. If one of these sounds familiar, don't worry, I've got you covered. We're going to fix that. And these three things, it can only be one of them that is what causes your overuse injury, or it can be a combination of all three. It's not just one thing. Running injuries and pain, it's multifaceted. There's lots of different things that are going on. But let's dive in. I like to keep things simple. The how of recovering from injuries and preventing injuries is a three-step solution. 3 steps. I keep it simple because complex doesn't work. It sounds fun. They sound fancy, but they don't work as well. Okay, back up. 3 simple steps to fixing the foot and ankle pain. So step 1, strengthen your feet and ankles. Like I said, a weak foundation of your joint, whether it be your ankle, hip, or knee joint, but a weak foundation, in this case, your feet and ankles, leads to injuries. Plain and simple. You need to build strength in the muscles that support your feet and ankles. And to do that, I recommend, there's 2 of my favorite exercises. Number one is the short foot exercise. It's arch activation. I'm going to link all of these exercise videos down below so you can see what you should be doing. Short foot exercise. This helps stabilize your foot when running. It helps support your ankle. It helps support your foot. Second strengthening exercise is the calf raise with the ball string squeeze. You are literally taking a tennis ball, a lacrosse ball, a rolled up towel, something, putting it between your heels and doing a heel raise. Simple as that. These exercises take just a couple of minutes to do. You can incorporate them into your strength training program. You can do them when you're brushing your teeth, sitting at your desk, driving in the car. Find time to do these a couple times a day if you're prone to ankle injuries or having ankle pain. If you need a strength training program and you're not doing one, I'll link down below my 12-week beginner strength training program that I developed specifically for runners to help build a great foundation. Intermediate and advanced are coming later, but if you're just starting out with strength training, it's a great place to start. Step number 2, improve your ankle mobility. If your ankles are stiff, your foot has to overwork and your muscles work in a way that they're not used to, which puts more stress on them, which leads to pain. My favorite drill for ankle mobility is the half kneeling ankle mobilization. Again, I'll link it below, but you're down on one knee like you're proposing, and you're literally just leaning forward over that front knee. Hold it for 10 seconds when you feel a stretch and then coming back out of it. You're keeping your foot flat on the ground and leaning forward. Better mobility, better movement equals less pain. Mobility is not the same as flexibility. I don't care if you're the most flexible person in the world, as long as you can have enough flexibility to move through the range that running requires when you go through plant, push, step off, all of that through the running mechanics. That's the type of mobility we need. You don't have to be super flexible, but you do need to be able to move through the range of motion that running requires. And finally, step 3, right here, train smarter, not harder. You've heard it before, but most of my runners that come with some sort of injury, all of my runners that come with overuse type injuries, they are not following a good plan. They did too much, too soon, too fast. They overloaded their bodies without enough recovery, and they ended up getting injured. So we don't want to stop running. I almost never make people stop running, but we need to rework things. Gradual mileage increases, cross-training and strength work should be part of your program. A stronger body handles impact better. Again, I'll link my beginner strength program down below. And then also having a structured recovery plan. You need sleep, you need rest. You should not be working and training every single day, every week, every month. You need rest days. So make sure you have a correct plan, running plan. Get a running coach. I do run coaching. Get a good run plan and incorporate a strength plan into it like I have linked down below. Now, don't worry if you have an ankle or injury pain or you're susceptible to them and you've had injuries before and you want to prevent them. You don't have to figure this out all on your own. I created a 12-week step-by-step foot and ankle injury program to prevent injuries and to recover from injuries that walks you through mobility and activation drills like I talked about before to improve your flexibility and your overall range of motion, strength and stability exercises to make your feet more resilient and your ankles more bulletproof to help you prevent and recover from injury. And then it has a structured progression to get you back to running pain-free or to help you prevent recurring injuries if you are susceptible to ankle and foot injuries or have had them in the past. If you are serious about staying injury-free, click the link below or go to therunnerdoc.com to get the full program today. I'll link it above. Remember, injury prevention isn't about just getting rid of pain. It's about getting back to running stronger than ever. If injury rehab was just about getting back out of pain or getting rid of pain, rest would be your solution, because if you don't run, you don't have pain most of the time. But we don't want to do that. We want to get back to running without pain and stronger than ever. If this video helped you, make sure to hit that like button and subscribe for more injury tips, and I'll see you in the next one.